With great power comes great responsibility. If you apply this superhero quote to chemotherapy, you could also say that with the great power or effectiveness of the medication come a few side effects as well. Maybe one could also say it's kind of a mixed bag. Because in chemotherapy, multiple active substances are often combined in different dosages, and that's why the side effects are also very diverse and vary in intensity. On top of that, every body reacts a bit differently to cytostatics, that is, to the chemo drugs. That depends, for example, on your individual predisposition, whether you've already undergone other treatments, and so on and so forth. Every person is unique, and that's a good thing. The doctor is obligated to inform you about all possible side effects, those that may occur immediately, that is, acutely, or those that may appear later with a delay. But, of course, that doesn't mean that everyone reacts the same way to chemotherapy or experiences the side effects in the same way. So remember, if your doctor says that a certain side effect may occur, that doesn't necessarily mean it will happen for sure. But I want to be honest with you. A big part of chemotherapy also involves dealing with these side effects. And because these will take up some space in your daily life, let's go through them. We will also take a closer look at some of them separately in other videos. We'll go into them in more detail. But I'd like to briefly give you an overview of the most important acute, meaning immediate, side effects here, so that you simply know what to expect and get a general idea, okay? So, one of the most obvious side effects is, of course, hair loss, right? It doesn't physically hurt, but losing your hair can really take an emotional toll. Fortunately, the hair does grow back once the therapy is over. Another common side effect involves disturbances of the digestive system, right? This can lead to nausea, diarrhea, nutritional issues, or constipation. In this case, it's important to drink plenty of fluids so the body stays hydrated, and if possible, eat small, light meals. A very common side effect is also what's called aplasia. That means far fewer blood cells are produced than the body needs. If you have fewer white blood cells, you're more susceptible to infections and might, for example, develop a fever. If you have fewer red blood cells, you often feel tired. And if you have too few platelets, you may be prone to bleeding. Fever and flu-like symptoms, that is, flu complaints, also occur frequently. And there's a kind of golden rule. If the temperature reaches 38 degrees Celsius, the fever must be treated in the hospital. And finally, it's also important to mention changes to the skin and mucous membranes. So skin care and especially oral care play a major role during any chemotherapy treatment. So when you list all of that, one after the other, you really have to take a deep breath, right? But I definitely want to reassure you now that many of these symptoms can reliably be prevented or at least be reduced. And of course, your child or you as a teenager will be monitored very closely during the treatment. For example, regular tests of blood values and organ function are carried out to check whether everything is in order. And one thing is really important. If you're able to go home at some point during the treatment, which is an important step for you, then it's absolutely crucial that if you or your child develops a fever or pain, then please always, first of all, where is it? Call the ward, okay? So that the treatment team can tell you how best to respond in that situation. Yes, which medications make sense or whether you need to come to the hospital. So make sure to place the ward's phone number next to your landline phone at home and save it in your mobile phone, okay? And if you're ever unsure whether you should call the clinic or not, just do this. If you notice something new or different, something you haven't seen since the start of the chemo, even if it's just a pimple, then pick up your mobile phone or landline, okay? The staff at the ward is always available, whether it's day or night, okay? And they are there exactly for that, to help you when you're not sure what to do. So it's better to ask one time too many than one time too few.